Today we'll be going over insulin, which has the trade name Novolin R. This is an injection rather than taking it orally. So here we have my injection for insulin. The therapeutic class is antidiabetics hormone. So you would use this as indicated when you have hyperglycemia, which means too much glucose in the blood, with a patient with diabetes. Also, this could help with hyperkalemia, but it's not really intended for that use. It lowers blood glucose by causing the skeletal muscle to absorb glucose into the muscle rather than into the blood. So the glucose goes from the blood into your muscles, which lowers it in the blood. Be aware for contraindications of hypoglycemia or if you have allergies. So this lowers your glucose, so you want to be aware if you're having too much glucose in your blood. Also, you want to be cautious in case you have an infection. Since this is an injection, you want to be sterile. So you would use a cotton swab and you would rub in and then slowly out. So as the patient, you would not do this. But here's your bottle of insulin. And if you're mixing two of them together, you want to make sure they're compatible. And what you do is you take an alcohol swab wipe, you swipe it, and then you inject air into it first. And then you tip it upside down so part of the needle absorbs it. And then you retract the amount of insulin of the air that you just put in. Special considerations are this is a high alert medication, which means it could be fatal if administered the wrong dose. This is why you have people double check and sign off on it. What we teach the patient is that this shot is given subcutaneously, meaning they have the option of taking it in either arm or in either abdomen. So you want to pitch. So you would give it this part, the fatty part of your arm, and you want to give it, first you put the swab, then you want to put the injection in at 90 or 45 degree angle, and then you wait 10 seconds per unit as you push down. So you can take, it may seem like that's a long time, but when you do it, it goes by really fast. So you want to go slow, and then you wait like 10 seconds after, and then you wipe. So the patient can choose either arm or either quadrant, and you just want to make sure that you're pinching rather than just giving it. We would want to help teach the patient about a proper diet so they can relieve their symptoms of dehydration or hunger, because those are symptoms. And so we would teach them to eat carbohydrates, which helps them stay full, and also to have saline solutions like Gatorade to help with dehydration. In an emergency, they would want to call a doctor if their blood glucose is above 250 milligrams.